Connie's in charge of medical photography at a busy practice. She is overwhelmed by the time it takes to capture, transfer, and catalog patient photos. And also, she struggles with the quality and consistency of before and after images. Connie researched traditional medical photography solutions and found them to be bulky and expensive, limiting photography to a single exam room. Well, then she discovered RxPhoto by AppWorks. Created by physicians for physicians, RxPhoto is medical photography reimagined. Connie's practice can now use a mobile phone or a tablet to securely capture, manage, and share high-quality medical photos from multiple exam rooms simultaneously. And thanks to the patented photo ghosting feature, before and after images are always consistent. Patient photos are stored directly to a HIPAA-compliant cloud server, where they can be securely accessed by office staff. So what can Connie do with all these great photos? Well, with a touch of a button, they can be sent here, 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 or here. This helps Connie's practice market and illustrate services, moving more patients from consultation to procedure. RxPhoto also includes a wealth of useful tools, such as drawing and annotation, injection tracking, custom tags, consent forms, and much more. Now that Connie's office is using RxPhoto, she's feeling pretty good about herself. Her team is spending less time managing photos and more time caring for patients. Her patients are happy because they can see their great results. And her physician is happy because better photos mean more business. Quality, consistency, security, and increased revenue. That's why so many physicians are upgrading to RxPhoto. Sign up for a free demo today.
So these fantastic new devices have the ability to put doctors and patients together like never before. To be able to harness this technology that's in your pocket and be able to utilize them so that a doctor and a patient can communicate is opening a new area of medicine that is unprecedented. This app has actually become kind of like an X-ray is for maybe someone with a broken bone. Patients are like, yeah, this is really what's bothering me. And you can assess and tell them, I think I can help you. And along the way, it sets a baseline. And as you help them, they're able to see the progression. One of the great things about this particular app is you're able to see the veins in their worst scenario. So standing up, maybe after having walked for a bit. And that is not how we typically see them now when we operate. When we operate now, the patients are lying down, they're in a sterile condition, the veins typically have collapsed. When you come in, we would have already seen your pictures and be able to spend time together strategizing how to really address the concerns that bother you. This really changed the way we practice and really differentiates us from a lot of other practices.
My name's Travis Shaw. I'm a facial plastic surgeon in Richmond, Virginia. I've been using the AppWorks program for about 2 years. Prior to this platform, I was using a digital SLR format setup, which took a lot of time in trying to get photos from the camera back into a desktop, utilizing those photos there into Photoshop, and then cataloging, adding patient's name, demographic information, which consumed quite a bit of my time. I handle most of my own photography myself, and so this was a kind of a big thing for me in the amount of time that I had to use. So I began looking for another more efficient platform that would be out there and came across the AppWorks. Set up a demo with their people. They were very helpful in letting me take a look and get a demo of the software, and really liked what I saw. We then began utilizing AppWorks in conjunction with an iPad. I now have my staff handle my photography, which frees up my own time to be able to spend more time with patients, which has really been great. I would say roughly it's probably cut our total photography time down by about 75%. That's great. My staff's been very happy. They find it's an easy program to use. They now do all the photography all by themselves without my supervision after having trained them on the program, which is really pretty easy to use. So they've been very pleased as well. In terms of putting demographic information, diagnosis, different treatments, and that's all at my fingertips within the app itself, which is one of the things that I really like about it. I've been able to show a lot of before and after photos to my patients during consultations, which has helped increase our consultation conversion rate. I would certainly recommend this program for anyone who's looking to try and free up some of their own time to be able to catalog and take before and after pictures in an easy and efficient manner.
Hi, my name is Cammie Owen. I'm a nurse practitioner and one of the founders of You Only Younger in Sugar Land, Texas. For 6 years, we've struggled with patient photos. They've been unorganized, they've been inconsistent, and storage has quickly become a problem. I've spent hours sifting through unorganized before and after pictures, trying to find something adequate for our marketing material and our website. After hearing about AppWorks, I immediately set up a demo and found that this was exactly what we were looking for. This system has really made it easy to hardwire before and after pictures into our process, and now we have good, consistent before and after pictures that we can use to help consultations convert into actual clients. One of the biggest benefits I find from the program is I'm able to show clients their before and after pictures immediately. That solidifies their decision in having a treatment, and it also makes sure we're on the same page of their results. AppWorks has made my life so much easier. I can now take 3 to 4 minutes getting before pictures and after pictures, and that leaves me much more time to actually interact with my client and do direct patient care. So one of the benefits of this program is that it protects us from outrageous claims or complaints, and many times clients are unaware of issues they have until they see it on a photo, and then if we're able to resolve one issue, another issue might pop up that was actually always there, but they never noticed it before. And this way, with the before and after picture, we can actually show them, look, this was an issue before, we're happy to take care of it this time, but this was an issue before, and now it's just more, you're more aware of it. I was apprehensive about using a new technology in our practice, but within a day I was up and running, and I don't know how I survived without it. I'm happy because managing and taking photos has just gotten a whole lot easier. On average, it used to take me 10 to 15 minutes. Now it only takes me 3 to 4 to actually take before and after photos of clients, and that just has streamlined our process tremendously.